feel that the healthcare professionals and the general practitioners with patients can actually engage and have an immersive consultation with the use of AR?
Yeah, I do think it's definitely something that we should be looking into in the future. There's a lot of devices out there, wearable devices, and augmented reality plays a role on them devices as well. So you can have apps that can help you understand what condition you have, or whether it be the likes of an ECG on a phone that can be sent into your consultant on the other end. There's definitely room for that sort of activity going on in the future. There is augmented reality that we could use on the likes of medicine packages, where we could have the patient information leaflet through a quick scan. Also, there's a lot of areas that QR codes could be used. They were used and tried in the past, not successfully. But everyone has a smartphone. You can scan whatever code comes up on your computer. And if we're working virtually now, people sitting at home, it might be an option to scan a code and it brings you through to an animation video about disease area awareness or mode of actions when it comes to medicines for a HCP.
And in terms of when you're really developing kind of a marketing communication plan, or actually looking to touch points with your HCPs and patients, how do you measure success at Pfizer? Because it's such a huge ecosystem. The communication and the touch points and driving brands to the right people within the sales organization. Measuring success must be quite difficult.
Yeah, you have to be clever about the metrics that you add. I suppose you can add a full raft of metrics, but if you don't know exactly what your objective is and what you want out of the campaign, you won't know what metrics to add. So when it comes to social media and digital, it's great. You can measure it quite easily. Measure the engagements, the likes, the shares, and if you have a clear call to action, whether it be a downloadable booklet or a visit to your HCP. Visiting a HCP is a difficult one to measure, and that's always what we want to know. Is the awareness campaign having an impact on the patient, enough of an impact for them to visit their HCP and get treated appropriately? But yeah, I think digital, that brings a whole new level of measurement. And it was very difficult to measure the likes of print media in the past, and digital media is a lot easier to measure with all the metrics that you can put in. But you need to be specific on the measurements that you have based on your objective.
Okay. And with all the kind of digital technology out there that Pfizer uses and in your personal preferences, which one would you say you love the most?
From a digital perspective, yeah, I love the virtual reality piece that we have developed. It really immerses you in what the medicine is doing and into your body. So it's all about going into your condition that you have and traveling through the body. So for me, I was fully engaged and fully immersed in what the condition was and what the medication is doing.
Is this are you speaking about the HARV?
Yeah, so HARV was something that Pfizer developed, holographic augmented reality video, HARV. So it worked really well, and we still use it to this day. It's 2.5, 3 years old. I think it has over 600,000 views on YouTube. So it's a fantastic offering. We've developed a new atrial fibrillation campaign called Keep the Beat. And that's running quite successfully now, but that's for the patient as well. It's disease area awareness. And it's letting people know that if they've AF, they need to, they can still live a normal life, but they need to be adherent to their medicines and also understand what an irregular pulse is or what a normal pulse is. And if they have AF, the likelihood of the impact of AF, obviously 5 times more likely to have a stroke if you have AF. So we want to make sure people are aware of the impact of AF, and also if they feel any signs or symptoms, visit a HCP. So yeah, between HARV and between our Keep the Beat campaign, there's a lot of education there through many digital channels for patients. So we're delighted with that disease awareness.
Finn, it's been great having you on Pharmacoms TV today. Been really interesting to learn more about the space that you're in, cardiology, and the kind of digital transformation that you are integrating into Pfizer. So it's been a real pleasure. Thank you very much for being on today, and have a great day.
Cheers, Adrian. All the best.